again, that's when you pinch it, the skin comes very close together, and that's really the most important part. Again, that's more important than the other subtle changes. The upper arm, we've done that. If we go to the next one, again, I was pleasantly surprised with Peter that even when I look at the ribs, I don't see the ribs showing through necessarily, and so that says that he's in good shape in that area. So what that also shows you is different parts of the body lose fat and muscle in different ways. If we can go to the next one. Oh. One of the things when I gave a talk at the Hansa a few years ago, I kept talking about my sneaky physical exam, and somebody saw that sign and said, keep calm and be sneaky. So I guess that's my new mantra. We've already talked about the next part. We've gone through that. I think, I don't know if there's anything else that we need to do. What's the next slide? For those people who do physical exam, and you said you do some of this physical exam, maybe you can share some of your thoughts, because I'm doing it more, but clearly that's part of your assessment. So maybe you can talk to some of the other dietitians or nutritionists to say, what are the things you've learned that help you in terms of understanding things?
Okay. Alguém tem alguma pergunta antes de mais? Sorry. It's a problem. Normalmente eu, desde que fiz, I do this from the first time that I assist to your...
Oh, you learned after the first talk?
I thought if I already shake hands with my patients for a long time ago, and when I shake the patient, I do this. It was normal for me to do that in my day by day. But then after the course that
in December?
Yeah, in December I started to do it. These things in my appointments at the hospital, and also in the inpatients at the hospital, when they are not a problem, so they understand, and they also find it funny to do it.
Kind of like Peter?
Yeah.
Yes?
If you explain it to them, and I think that they like the touch. When you touch them, you interact with the patient, and he feels, this is my thought.
Yes.
They feel comfortable. They feel that they are cared.
Yes. Yes.
They like to be touched. And so I have no problems to do this in my patients, because they think this is funny. I just explain it to them, and it's fine. And I can do, and I can see that sometimes, as you said before, that they have more strength in the right or on the left member, and that's the things that we cannot see if we don't push them, if you don't test them. So you have a different perspective when you do this. So I find it very, very useful to my practice, to my counseling. He's not doing what I'm saying, because I told him like 1,000 times to lift up a can. 1,000 times, and he's not doing it. He climbs the stairs, and you can see he's better. He's fine here, but the arms is not doing what he should do. But I find no heart to do it.
Now I have a question. You said you didn't do this before December. This was not part of your
just the shaking and see how it was here, and put my hands here. When I say hello and so on.
And since you started doing this, do you see more abnormalities in your patients than you would have if you just...
More sensitive for that.
Yes.
Much
so it's
more
worthwhile doing.
Yeah, and it takes 2 minutes.
Yes. Yes.
It's not a problem.
Any other dietitians or nutritionists since December, if you were here before, or whether you do this as part of your nutritional assessment, do you have anything to add?
I usually shake the hand and watch for these little signs. of physical exam because since I study at the university, I think it's the most important and more cheaper and easy to do, to look, to touch, and it's a very strong weapons to do our job against the costs and the equipment expensive somewhat.
Anyone else who does a physical exam as part of their patient assessment?
Can I say something?
Okay. Anything that you would like to add to what we've heard so far that in your experience you found helpful?
Faith, can I say something? Me?
Yes, go ahead while we're getting it to the next person. Where'd the other one go?
This is very. This was very helpful to motivate the patients to do things
Yes.
because they can see, they can feel that they improve.
I think that's a really good point. And so it's not just the touching, but it's empowering them to be able to have a difference.
Part of the treatment.
Yep. Okay. Harry has a question, and then I'll get this to you.
And it's a question to Ricardo.
Oh.
Yes, I warned you.
Okay.
You are a physician, and maybe besides Faith, the only physician in this room. Yes or no? Yes, okay, yes. I guess you perform physical exams for your diagnostics. Yes. What is your perspective in that context of performing a nutrition-focused physical exam?
I usually don't do a nutritional focus exam. I do a diagnostic exam. But when I'm assessing the neurological status, I also see the muscle tone and I see a subcutaneous effect. Now that I'm aware of it, I can do a sneaky part of it. I can do a sneaky nutritional exam in the middle of my diagnostic assessment. So I don't try it,
So
but
you teach physicians also, yes?
yes, you can teach physicians. It takes only more one or 2 minutes because it's already part of our usual diagnostic exam. Just have to be aware of it and to.
It's just a different way of seeing things and looking at them.
Yeah, just the difference of seeing it and doing what we always do. We are taught to do that. But we're teaching seeing if they're neurological effects. Yes.
Yeah. You were going to say something, if you have the microphone?
Yes.
Thank you, Peter.
I started doing this a while ago, but more complete since December. And what I find is it gives us a lot more information about the overall status of the patient than only looking to the labs or just do the weighting and just look at the symptoms. It gives the functional part, and that's a part of their quality of life. And as Luisa said, they feel more involved and they actually can compare their improvement with nutritional therapy and their increase of strength.
Anybody else who wants to add to that?
I don't see much outpatients. I see more inpatients, and sometimes we have to adapt. And then one thing we do is we see. One thing we see is how easy or not is the patient to get out of the bed to go in the scale for weighing. Sometimes I go and get the scale, and sometimes I see that the patient likes to walk, and he says, no, okay, don't go and get the scale, I will walk. And we see also if he's moving and his strength.
And I think you said you include this as part of your physical exam? Is there anything you want to add?
Not to add anything. Usually I look at the patient, I evaluate. Sometimes I think it's very important to see the edema on the ankle. think
Yes.
it's something that I always look at, along the hair to the feet. I think it's very useful to look and to touch and to measure some things, to measure things.
What do we have? I think. I haven't figured out how to make this turn on, but that's okay. Anything else that we need to do? We can go forward. I like this. The very thing that several of you said. The physical exam will strengthen the relationship between the nutritionist or dietitian and the patient. I think that was a common thing that several of you said, and I think it's really important. It will improve the quality of the interaction. But again, I think one of the things I would suggest for those of you who haven't done this before is to potentially, if you have an older relative, because a lot of times older people will have some of the physical findings, even if they don't have any diseases, and you ask your grandmother, or your great-grandmother, or your grandfather, you may actually find some ways of doing some of the physical exam that you'll actually see in a different way than if you weren't doing it that way. So I think the most important thing is the obrigada. I think this has been I think the group down here gets a particularly good round of applause. Including some of the shy ones that we have down at that end. But I think that sometimes going through this in a very practical way is extremely helpful. Now, I think there's one more thing we need to do, and that's a panel. And who all do you want up there? And then I might choose somebody else in addition.
Sonia, for the panel, so we can do it up front.